All right. Oh, no face. Let me do it. I know everyone wants to see my face. Okay, we're at the bottom of page 20. And so part of the skills test is to see how well you can just speak to the patient and be clear about what you want them to do. So I'll demonstrate that for you. You're going to demonstrate the sensory test on an unaffected extremity. So if I'm testing her left hand, let's say, when I demonstrate for her the test, I want to demonstrate a part of her body that I'm pretty sure has normal sensation. So that could be the right upper extremity, or it could be one of her lower extremities. Okay. By the way, I'm missing something, aren't I? Does someone see my face shield? Yeah. All right. So I got my face shield on. What else do I need, room 109? Well, someone show me where the large, or extra large glove.
I tried to do that. Sorry, to make you move that.
Sorry, 109, we're taking some time here. There we go. Thank you. So make sure you have your gloves on, because you're going to touch your patient. And we're in the middle of a pandemic. Okay, what else does it say here? Now notice when you actually perform the sensory test, the patient's eyes are what? That's very important. Can anyone tell me why?
That's really a cousin.
Yeah, if they can see, we're not really testing their sensation, because they can cheat with their eyes. You'll see what I mean in just a minute. Okay, so when you're testing the hand, you're going to do the entire hand, both the posterior and anterior side, and the foot, both the plantar surface and the dorsal surface. You take off shoe and soft. All right, so now we'll go to page 21. And the first test we're going to do is I'm going to see if Julie can tell the difference between sharp and dull. Now, what do you think about this? If I were to say, hey, Julie, I'm going to see if you can feel pain very well.
I would not do that.
Okay, so we probably don't want to say it that way, but that's kind of what we're assessing. So go ahead and use sharp versus dull. Now, room 109 has some of these instruments too, but we can use this flywheel to test sharp versus dull. Okay, so look at page 21 at the top there. So notice at the very top, I don't want Julie guessing, right? So I'm going to give her some options of what she can say. Let me just show you. Okay, so I'm going to test her left hand, so I don't want to demonstrate on her left hand because I suspect she has a sensory deficit there. So I'm going to use her leg. Hey, Julie, I'm going to see if you can tell the difference between something that's sharp and something that's dull.
Okay.
All right, so when you feel this, that's sharp. And I want you to say sharp. You can keep your eyes open. Yeah. So during the demonstration, eyes open as high. And you feel this, I want you to say dull. All right, so what are you going to tell me when I do this?
So,
And what about this?
sharp.
And if you can't tell the difference, just say I can't tell.
Okay.
All right? So why did I give that third option? Because I don't want her guessing.
Right.
So if she can feel something that she can't tell if it's sharp or dull, that's useful to me. So that third option is really important. And so I've just done the demonstration. Now I'm going to do the actual test. And I'm going to keep her hand up here just so everybody can see. Normally I'd have a hand by the side over here. Just lay it on your abdomen. Okay, just so everyone can see. All right, now Julie, I want your eyes closed. It's real important that her eyes are closed. And you tell me what you feel, okay?
Sharp. Sharp. So, sharp.
Okay. Here's something I'll see students do every once in a while. All right? Got your eyes closed. Tell me sharp or dull.
Sharp. So, sharp.
All right? We don't want a pattern to make it easy to guess. So you want to vary up. It's almost like you're trying to fool the patient. All right? And you want to cover all the hand as you do that. So if I'm going to cover all the hand, what do I need to do? I want to flip your hand over, okay? You turn it over. And it's hard for her to keep it up, so I'm just going to switch hands so room 109 can see. And scoot toward me a little bit. And just let your arm hang, lay down. Then I'm going to do the same thing.
No.
Is there a question with 109? Okay, I thought I heard somebody. Okay, so I'm going to do the same thing over there. Now remember, what you're trying to do is see if there is a sensory deficit. So how would I know if there's a sensory deficit? If she gives me the wrong answer, or she says, I can't tell. Now during the skills test, you all are going to be each other's patients. And here's what's going to happen on the skills test. I'm going to say, okay, Jordan, you can be nice. I want you to be absent. You can't feel anything in your C6 dermatome on your right hand. Okay? Now Julie panics, right? C6 dermatome. But there's no need to panic because during the skills test, the patient gets to look at the chart. And you as the PTA get to look at the chart. So the main thing about the skills test really isn't making sure you've got all this memorized. You just get to look at it. I'm more concerned that you can speak to a patient and you can carry out a fairly simple procedure with the patient. All right, so Julie could actually hold this up with her other hand and stare right at C6 while I'm doing the test. And so Julie will fake not being able to feel the C6. Either she'll say nothing or she'll say, I can't tell while I'm doing that. Okay? So, that's the sharp dull test. You do see in your notes there that you could do that with a paper clip where you have a dull side and a sharp side. But the pinwheel is better contrast for that. By the way, with the pinwheel, I see two things. If you push too hard, it really hurts. But then some people are scared of that and they don't push hard enough. So you got to get it just right. There needs to be a difference between this side and this side. Any comments on sharp dull? All right, I'm going to skip temperature for the last, and let's do light touch now. All right. So I'm going to see if Julie can feel light touch on her skin. So are you able to turn the camera all this way so we can see? Two different things we can use for light touch. I have a bag of cotton. In room 109, you have some cotton in your room. Or some of these reflex hammers that I have out there have monofilaments at the end of it. What's that? Oh, okay. Sorry. Thank you. So the reflex hammers. Sorry, room 109 is hard moving this big desktop around. But on the reflex hammer, I can push up, and there's a monofilament at the top there. So I'm either going to touch with the cotton ball or use the monofilament where it just bends when you touch the skin. Either one will work. Okay, now look at the directions there. Julie, I'm going to see if you can feel light touch. Let's say I'm testing her right foot this time. Do I want to do the demonstration on that right foot? No, I want to do somewhere where I'm sure she has sensation. So, Julie, when you feel that, I just want you to say now. Okay, can you feel me?
Yeah.
That's it, okay? Now, sometimes I see students do this. All right. Well, we don't want any movement going on. This is a superficial sensation. So we're just touching the skin. Okay, close your eyes, please. All right, and again, if I wasn't on camera, I would move over to that side, but just so you can see me. All right, you ready? Eyes are closed.
No. No. No.
And I'm going to do the whole dorsal surface of the foot, and then I'm done, right?
Yeah.
Now, very important is the plantar surface of the foot. And in fact, feet are a common place where people lose sensation, like because of diabetes. Often it's on the plantar surface of the foot. So it's real important to do the entire foot, including the plantar surface. In fact, are you able to scoot down so your foot is hanging off the edge? And this way, when she's hanging off the edge, I can get the posterior part of the heel too. Which I know it's hard for you to see me. But the idea is get the entire foot and do it, or the entire hand when you do it. Now notice, one instruction I did not get, and this gets students messed up too. Okay, so watch this and tell me what you think is a little weird. So George, you doing that. Feel this, I want you to say no. Okay? If you don't feel it, say I don't know. All right, you ready?
No. No.
And Julie looks a little confused. So why do I not want to say, if you can't feel it, say I don't know? If she can't feel it, what will happen? She won't say anything. If she doesn't say anything, you know she can't feel it. So you don't want to say, if you can't feel it, say I don't know. That makes no sense. If she doesn't feel it, she won't say now. So notice that's different from what we did with shark and dog. Okay, any questions from here or room 109 about light touch? By the way, remember we can do that with the monofilament too. So go ahead and close your eyes, say now when you feel. Either one of those is fine. All right, light pressure is very similar, but notice it's not the same thing as light touch. Okay, sometimes students get mixed up with this too. Light pressure, you're going to use your finger. And you're just going to push into the skin just a little bit. Remember, superficial sensation. So this time I'm testing Julie's left hand. All right, so go ahead and move this one down just a little bit. All right, so I don't want to demonstrate on her left hand, right? Right? Wait a minute, move. Mixed up, sorry. I'm going to test Julie's right hand. Okay, that's the one with the sensory deficit. So I'm going to demonstrate on something other than her right hand. Could be her lower extremities, but I'm going to use this upper extremity over here. When I do this, I want you to say now. Okay, so you keep your eyes open. That's it. Again, I don't want to give the option if you don't feel it. Say I don't know. If she doesn't feel it, she won't say anything. Okay, close your eyes, please. And open your hand up. Let's get everything out of the way. And go ahead and put your hand palm down. It's a little better on here.
Yeah.
All right, scoot toward me some more. Put your hand over here. Okay, eyes closed. Ready?
No. No.
Try to think right.
No.
So very comprehensive. Get all the dermatomes, all the peripheral nerve distributions. Now here's something I see students do. Tell me what you think about this. And again, I'd normally be on the other side, so you can stay. Right, eyes closed. What's wrong, Joey?
Putting my hand down.
So I'm pulling her because I'm touching her with my other hand. So even if something little like this, it confuses the patient. So nothing should touch other than what I'm doing. Okay, so be careful of that. Okay, any questions about light pressure And actually, let's open up this hand right here. No, I'll do the right hand. Be careful of this. I see this. The patient should just be relaxed. Flip it around so they can't hear the neck. All right, eyes closed. Okay. Even on the fingers, I don't want movement. It's a very light touch. Just pushing into the skin. So you shouldn't be causing movement in any joints. Yes.
Is it important to actively let them know whenever you're gonna like switch them in or?
Yeah, let them know,
Okay.
and then make sure the eyes are closed. Anything else? Room 109, any questions? All right, the last one is temperature. Room 109, you're going to watch part of this, and then Samantha's going to pause, and I'm going to need you to walk room 109 in just a minute, not yet, to the back where the storage areas are. Okay, but I'll let you know when. So now I'm going to see if Julie can tell the difference between something that's hot and something that's cold. So we're going to use test tubes for that. And room 109, you have some of these test tubes in there. So I'm going to get one of these. And we're going to put hot water in one and cold water in the other one. And the thing is, you can't just use tap water. It has to be a big difference. So I have ice water in here, for instance. And room 109, you have a bottle with ice water in your room too. This happens to leak. That's what I'm going to do over here. So I'm going to put ice water in my test tube. All right, that one's ready. And now I need hot water in another test tube. And where can I get hot water from? We have a hydrocollator that's in the back of this room. So tell you what, room 109, let me show this group first. It won't take very long. And I'll have you all come back there. So Samantha, go ahead and pause, please. All right, so now I have a test tube of hot water, a test tube of cold water. So I'm going to demonstrate for Julie. And let's test, uncross your feet, please. We'll test the right foot again. So keep in mind, on your skills test coming up, you're going to test one hand and one foot. Okay? So you do want to practice with both. So I suspect a deficit here, so I'm not going to demonstrate there. I'll demonstrate on this side. All right, Julie, how does this feel to you? How about this?
Cold.
Yeah, all right. All right, so when you feel this, I want you to say cold. When you feel this, I want you to say hot. Do I need to give her a third option? I don't know.
Yes. Yes.
Yes, because she might feel me touching her, but can't tell if it's hot or cold. So if you can't tell, say, I don't know. All right, great. So then keep your eyes open.
No cold.
Okay. Sometimes that happens. All right, so I might want to, just try it again. What's that?
Cold.
All right, what about this?
Hot.
What about this?
Hot.
Okay, eyes closed, please. And then we're going to do the entire foot. Now, sometimes I see students do this. Be careful of this. What was that? Oh, pretty good, actually. There's no need to do it quick. And get a lot of surface area on it. So we don't need to do just the tip. Just lay it on there.
Hot. Hot. Cold. Hot.
Okay, and watch out with the feet, because especially on the plantar surface, a lot of people have thick skin, calluses there. You might need to really lay it on there and leave it there. Okay, so you don't need to bounce it on there.
Cold. Hot. Hot. Cold. Hot.
Okay, she just gave me a wrong answer. So what did that indicate? She has a sensory deficit there. Some of you will have sensory deficits maybe. Or she was just daydreaming and thinking about something else. So I might want to try there again.
Cold. Cold. Aye. Aye. Aye.
Do I want to do the toes? Yes. Okay, so you really got to be thorough with it, especially the plantar surface. A lot of people, just normal people, have trouble feeling that. Now, be as comprehensive as you can, either the whole foot or the whole hand. All right? Okay. Any questions about assessing temperature? All right, so something else to keep in mind, and you don't need to worry about this right now, but as a patient, the patient is either going to have a deficit in the dermatome or a peripheral nerve distribution of the hand or the foot. But what I want you to practice right now is just going through the sensory test. So you're going to stay in your groups of 4, have one person be the patient, one person be the PTA who's testing, and the other 2 need to give feedback. So you're helping each other as you do this. And try to do it so all 4 people practice all 4 of the sensory tests. Are there any questions in this room or in 109? All right, here we go.